As part of efforts to kickstart a phased return to normality, authorities here have proposed the temporary adoption of vaccine passes for entry to public venues. Now, the proposal has been met with a bit of controversy, and for more on this conflict, I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
I also have visiting Professor An Jun-sung also from Yonsei University. It's been a while, Professor An.
Thank you.
Meanwhile, joining the session virtually is Professor Richard Carpiano at the University of California, Riverside. Pleasure to have you again, Professor Carpiano.
Thank you for having me back.
Right, first up then, Professor Kim, I understand some 5.8 million people here in the country have yet to register for COVID-19 vaccination. What more can you tell us about them?
Well, it's a bit surprising we have that high number. It's the data by the end of September, and among them, only 8.9% are willing to have vaccination, and they're not making an appointment yet. And among those groups, more than 1 billion is over the age of 60, which means they might belong to a high-risk group. And last week, we have a daily average of COVID-19 cases above 2,400. It's still high. And most of the cases who got COVID-19, I mean, 92% not finished their vaccination yet. So that means we have to finish the second shot and spend 2 weeks to have enough immunity to fight against. So I would like to share some data of some Asian countries, and Korea has about 40 cases per million, and Japan and India has less than 20 per million, which means only a half of Korean. And Taiwan is less than 1 case per million. So if you look at the other Western countries, Sweden has about 60 cases per million, Canada and Germany about 100, and USA have more than 300 per million, and the UK has more than 400. But UK and USA are declining right now. Good news is weekly average of Korean data is decreasing slowly. I think it's good news, and if we pass through this long holidays, I think it will continue to decline. Mortality of COVID-19 has decreased because we better understand about the disease, and also we have a vaccine. But the mortality of unvaccinated patients is 3 times higher than patients who got vaccinated in Korea. It is about 0.4% in unvaccinated people compared to 0.14 in vaccinated. So why is it that? I think why is people do not want to have vaccination? I think they are afraid of side effects, and some might have a bad experience after the first shot of a vaccine. So we have to eliminate the exaggerated information about the side effects, and we must provide accurate and subjective information what happens after the vaccination, and we have to keep our efforts to find safe and secure vaccines, especially the new ones is coming soon.
Right. And moving forward, Professor Kim, what has been shared then about the gist of the vaccination passes that authorities here in the country are looking to adopt?
Well, it's going to be a temporary plan, the way to living with COVID-19. And some foreign countries consider about 6 months of duration to use this vaccine pass. And our government is saying that the purpose of this vaccine pass will be lower the infection risk for unvaccinated persons, and it will not be applied to children. But there are some skeptical views about the effectiveness of this vaccine pass, and there are disputes on the purpose of this if it is about to booster vaccination rate. If you look at UK, they have a disagreement within the government. I mean, the security of health and the security of culture are saying a different voice. And the Secretary of Health is saying that if the vaccine pass is mainly used at the nightclub or some pubs, the effectiveness is very doubtful. For Korea, our government has already shown many efforts to inspect nearly more than about 1 million entertainment businesses since the outbreak to make it sure that they are willing to follow quarantine measures. Whatever kind of vaccine pass to be implemented, we must make it sure that all of us are going to keep the rules, and especially in the places with drinkings, singing, dancing in a confined place.
Right. And Professor Carpiano, you are currently in Los Angeles, and I hear one of the toughest vaccine mandates looks to go into effect there come November 4th. Could you tell us a bit more about this?
Indeed. So this builds off of follows in the lead of several cities already in the United States, namely New York and San Francisco, as well as even some rules in Los Angeles County, the county in which the city of Los Angeles is located. So, but this is additional and adopted by the city council. Rather surprisingly, given United States politics around mandates and other sorts of vaccination requirements, rather overwhelmingly, actually. And so it will require everyone who's age 12 and over to be fully vaccinated before entering bars, gyms, restaurants, indoor facilities. And the alternative to that is that someone could also provide just a negative COVID test within 72 hours of entry to those places in case they have some sort of exemption due to religious or medical beliefs. Now, the question still remains, though, of course, there's a high likelihood that this will be successful. There has been really some public sort of support for different types of mandates and requirements. But the question really does remain, though, to be seen like how well these rules are really going to be enforced. But overall, it really, I think, very good news for because Los Angeles is the second largest city in the United States.
Right. And before I ask you about your opinion regarding this mandate, Professor Carpiano, how is the public there responding to this mandate in Los Angeles?
Well, Los Angeles is, even for California, which is generally seen to be doing fairly well in terms of COVID and in terms of sort of public attitudes towards public health response relative to some other states in the United States, has generally tended to be a bit of a leader in terms of taking more sorts of aggressive actions towards dealing with COVID than what we've seen more statewide, or even in some respects throughout other states throughout the United States. So in this case, it's a thriving economy. It's again, as I said, the second largest city in the United States. So really, anything that is going to be good for public health is going to be good for the economy. A year and a half now into this, people really are looking to get out and enjoy some semblance of life. What they had pre-COVID. And so really that measures like this, amidst the other sorts of incentives that have been tried out and the other sorts of initiatives to get people vaccinated, this is sort of the next step to this. And unfortunately, particularly as the colder months are approaching, people are going to be indoors a bit more. These are the types of measures that unfortunately that we've need to take, but still seem to be quite popular even among business owners, who over on their own have been adopting verification type systems to protect their customers, protect their workers. And so in a way, this in essence standardizes it across the city.
Right. And back here on the local front, Professor An, a recent survey shows that 2 out of every 3 people who were surveyed, that is, support the adoption of vaccine passes. Now, having said that, what are some of the points of contention with regard to the debate over vaccine passes here?
Well, actually, before we talk about the issues regarding the introduction of the vaccine pass, we need to check the number. Just show briefly, and the current vaccination rate for the first shot in Korea is 77%, and for the second shot is about 57%. So if you average of 2, it's about 67%. And however, according to the press, about 92% of the new infection cases comes from either from the unvaccinated or the first shot only. So there's numbers. So let's go back to the survey, actually. If you look at that survey, that about 2/3 of the people in favor of the introduction of the vaccine pass is about roughly same, right? 66, right? So about the same percent. So it means that there's a clear line between the vaccinated and unvaccinated group in Korea. That's kind of concerning because there's a lot of issue about social inequality issues, and as like the U.S., it's like many people have medical belief or other religious belief that tend not to take it, the shot, right? So that's the issue also, right? So also the concerning is that about the from legal perspective, since there might be a possible discrimination against the unvaccinated group, which is the minority, right? Because it's 1/3 only, right? Less than 1/3, right? So I think there's a growing concern about the mandate, introduction, the mandatory introduction of the vaccine pass, but the question is that I think it's more important actually that how the government will implement it in detail, right? It's not about the idea about the vaccine pass, right, as an incentive system for the more higher vaccination rate in Korea, right? I think that's more important how we implement it.
Right. And staying with that, Professor, and as a scholar in the field, what are your thoughts on allegations that vaccine passes violate basic rights?
Well, well, theoretically, I mean, it's really possibly can infringe on fundamental right because you infringe on many things. You have right to your own, your body. You can choose to make a right, major decisions in your life, right? Basically, it's a very critical issue. But however, I think that it's more like if you look at the legal perspective, is very kind of very concerning. But look at in terms of policy, government policy, maybe we should think about more the focus on persuasion, to get the public consensus, right? For example, I was thinking about some example like, the north wind and the, north wind, the sun, the story about if you, try to get who's stronger, right? Well, it's not about the power and forces, right? It's more like a persuasion. How can you persuade it the other side, without any, forces, right? So I guess that the way I see that the Korean government is very anxious to get higher vaccination rate, very very quick ways, for in terms of the public, health concern, right? However, to get the big picture as a society, all different group individuals, you think about the minority group, how they think differently, and how can we persuade them in getting together as a, one society, one team, right?
Right. And staying with that, Professor Carpiano, you are a professor of public policy. Where do you stand on the debate over vaccine passes?
Yeah, I think they're very good. But I would agree that they should not be the first line of action. They should be used. Other incentives should be used first, and that this is. But unfortunately, we've kind of gotten to this point of needing safety in terms of uptake being inadequate. But at the same time, I mean, we have to recognize that the vaccine passport, while that might seem maybe imposing, is really not all that much different than so many other things that we have policies around that require verification. So we need verification to travel. We need evidence of being of adequate age in order to enter a bar, a nightclub, or to purchase alcohol. We need a valid driver's license to operate a vehicle. So in many respects, a vaccine passport can enable freedoms. It shouldn't be really be viewed as sort of a burden, or if so, just in terms of a minimal burden. In terms of thinking about community safety and everybody's responsibility for contributing to that.
Right. And Professor Kim, from a medical perspective, what is your stance on calls for vaccination verifications to partake in a range of social and professional activities?
Well, first of all, I would like to talk about the Denmark, how they did with the vaccine pass. I think they're the first country in the EU to start with the vaccine pass, which started in April, and they did the antigen test at the entrance of public facilities, and they encouraged vaccination with that, and they returned to pre-pandemic on September 10th. So they're actually doing very good. I think they have an geographically advantage as a peninsula to control and quarantine measures. And if we look at Israel, which is one of the first country in the world to start vaccination with RNA, and they gave some incentives with they call it green pass, and When the vaccination rate reached about 40%, they realized that there was some redundancy, and they gave out incentives with that green pass. They had to revive because there was a surge due to Delta variant. And currently, this green pass is valid until the end of 2020, and that means they upgrade it regularly. And they upgrade the eligibility for green cards, which embedded a QR code, and they check whether they finished the vaccination 2 weeks before, and whether they are recovered from COVID infection, and if it's antibody positive or negative for PCR, which gives a temporary green card. And we have to remember, it is not going to be a perfect measure because COVID-19 spread before symptom, and we have a vaccinee with asymptomatic infection which transmits. So if we want to have a successful vaccine pass, I think we should have a similar strategy, including the things that I mentioned, and learn the experience the other countries have.
Right. And speaking about the experience of the other countries, Professor Kim just mentioned, Professor Carpiano, the testing option that people who cannot be vaccinated can have. And this is something you mentioned is also the case over in Los Angeles. But I understand such testing option is not available in New York. In that scenario, then, what other options are there for people to access multi-use facilities?
That does become very difficult, and certainly that can be creating access and inequity issues. Fortunately, there are very few. There's a small group of people that would be affected by having some sort of contraindication for the vaccine in that regard. And in many cases, and this is starting to become a bit more of a controversy or a debate in the United States, is to what extent really that religious exemptions should be allowed to begin with. While they're based upon personal belief, we also at the same time know that many of the major religions have endorsed vaccination, so that becomes a bit tricky in terms of validating those, and certainly we're beginning to see some legal challenges around those as well. And so these are important issues that we do have to consider. That a verification system is not going to be perfect, and at the same time, people who aren't able to be vaccinated, we also have to recognize the fact that by going out, they are being placed at risk for contracting. And so in that respect, a person who may be under-vaccinated or not vaccinated at all, in that case, while that might seem to be preventing people from accessing things, in many instances is also an important means for the community to be trying to provide protection for them and their families as well.
Right, that is one way of looking at it. And Professor, what do you propose? I understand this will be a tough question, but what do you propose then to allow for a greater public consensus on the issue of vaccine passes here?
Well, actually, I was take some time to think about it. The situation is not easy, but I looked up the Danish case closely, and there's some lessons we can learn from it actually. First thing is that in Danish system, they do not call it the vaccine pass. They call Corona pass or Corona passport. What's the difference? Well, in terms of a vaccine pass, right, means that it's like whether it depends on the vaccination status. You're vaccinated or unvaccinated, right? But if you have a Corona pass, means that like the one Israel, right, green pass, something is different, right? So I think that's the one way you need to narrowly tailor or really very carefully draft the policy, how to have the positive impact to minimize the negative impact from the public, right? Also, other thing is that the other way is that it's much broader, the scope, right? As the Professor Kim talked about already, it's 3 types, right? We might talk about is it vaccinated or the tested positive, or negative, I'm sorry, negative, right? Also the recover from the disease, right? So it's broader, it's not about vaccination itself, it's broader whether you have immunity, right? It's an individual immunity, not individual vaccination status, right? So I think that's the one give kind of more. And then lastly, the difference is that, right, US system, right, Right, the difference, right, okay, that's right, okay, I'm sorry, okay, right. Okay, I think so. I find very interesting that in the Denmark, right, there's a system that works, and when you get a public place, to get access, like a movie theater or the library, you can show the pass, right, or you can have the quick test, right, on site. And you have to wait like 20 minutes. Actually, personally, I went to Jeju and conference last summer, actually, and I did the same thing. I have to wait like 10 minutes to get a PCR test, and a very quick one. So that if you can wait 20 minutes, and can get it. So basically, they do not prohibit the access because it depends on the vaccination status. If you're not vaccinated for your medical reason or religious belief, you can wait 20 minutes. And if you are clear, you can get in. I think that's the one kind of positive impact. And then I think they're focused on more like traveling situation. If you want to go overseas, you have to get vaccinated. I mean, get a pass, right? It's not us. Right? So, like I think it's like finger pointing, blame game. Well, it's not us to make you too vaccinated. It's the other country make it vaccinated because for you, it's not for us, right? I think that's kind of a public policy, PR issue. I think they put more attention on, close attention to how you get PR in your job on the vaccine pass in Korea. Right.
Professor Carpiano, what can you share with us now about cases of forgery, I believe, amid the requirement of vaccine verifications, and how are these incidents being tackled in the US?
Yes, well, whenever there's a new rule or some sort of regulation that gets enacted, there's always going to be some individuals who try to avoid them, and vaccine verification is certainly no exception to that. So very much like Korea, the U.S. has definitely seen already efforts to produce and distribute fake vaccination certificates. And the paper certificates, the vaccination cards are a lot easier to fake than the digital apps are. And so we definitely see some differences with that and how technology can actually help prevent that. But we also do have laws that exist for dealing with criminal behavior, and they're definitely enforced. But again, technology, I think, is a way to make it much more difficult. But when it comes to implementing a passport system like this, I think it's important for people to not fall into this trap of what we sometimes call the perfect solution fallacy, which is this false logic that just because, in this case, fraudulent vaccine records are going to be existing and they can't be completely prevented, that therefore the verification system can't be effective in reducing risk and improving public health, and therefore shouldn't be used. Because, if you think about it, we still require valid age identification to enter a bar or a nightclub, buy alcohol, even if we know that there are youth that are going to try to gain entry using false identification too. So, very much a very similar situation holds here as well.
Right, a valid thought right there. All right, Professor Carpiano, as always, thank you very much for your insights today. Professor An here in the studio, thank you for your thoughts. And Professor Kim, thank you for being with us today.
Thank you very much.